Hello and welcome to The Explainer. Today, we're jumping into a really important topic, cervical cancer. Now, this is a disease that affects hundreds of thousands of people, but as we're about to see, it's one we have a remarkable amount of power to prevent.
So I want to start with a question because it really gets to the heart of what we're talking about. What if one of the most common cancers that affects women all over the world was almost entirely preventable?
Well, believe it or not, that's the incredible story of cervical cancer. So in this explainer, we're going to break down what it is, what causes it, and most importantly, how we can fight it. Because this isn't just about understanding a disease, it's really about empowerment. All right, so let's start by getting a handle on the scale of this challenge and just the basics of the disease itself. Okay, first up, a quick anatomy lesson. The cervix, it's that lower, narrow part of the uterus that connects to the vagina. As you can see right here, it's a pretty small but absolutely critical area, and it's where this type of cancer develops. And here is exactly why this matters so much. Globally, cervical cancer is the fourth most common cancer in women. I mean, just think about that for a second. That's a staggering number of lives impacted by this disease every single year. Now this reveals a really crucial part of the story. There's this massive global disparity. Over 80% of cases are found in lower resource nations. And that's not a coincidence. It's a direct result of unequal access to the very tools that prevent this disease, things like vaccination and screening programs. So if prevention is the name of the game, we first have to understand what causes this in the first place. So let's take a look at the virus that's behind it all. Right. The main thing you need to understand is this. Almost all cases of cervical cancer are caused by a super common virus called human papillomavirus, or HPV. Now, for most people who get HPV, their immune system just clears it right up, no problem. The danger comes from a persistent, long-term infection. That's what can cause cervical cells to change over time. But while HPV is the main culprit, it's not the only piece of the puzzle. Other things can increase a person's risk, like smoking, long-term use of certain birth control pills, or just having a weakened immune system. Now, these things don't cause the cancer on their own, but they can make it harder for the body to fight off that HPV infection. Okay, so let's look at how that persistent infection can slowly, over time, progress into cancer, and what kinds of warning signs might pop up along the way. The journey from getting an infection to actually having cancer isn't some sudden event. It usually happens over many years. It starts with something called dysplasia. Basically, these are abnormal-looking cells on the cervix. They aren't cancer yet, but they are a huge warning sign. And catching the disease at this early stage, that is exactly what screening is designed to do. Now, if those cell changes keep progressing, the body might start to send out some signals, things like unusual bleeding, persistent pelvic pain, or changes in discharge. These should never, ever be ignored. They're like your body's alarm system, telling you it's time to see a doctor. And this diagram, wow, it really brings that whole progression to life. You can see how the cervix goes from perfectly healthy to developing these early stage changes, and then to a later stage where the cancer starts to spread. It's a really powerful visual that shows exactly why catching this early is everything. And this brings us to the most powerful and honestly the most hopeful part of this entire story, the solution, because we are far from powerless against this disease. So, the big question is, what can we actually do about it? How do we take all this knowledge and turn it into action to protect ourselves and, the people we care about? What's so incredible here is that we have this powerful two-pronged approach. On one side, you have prevention with the HPV vaccine, which can stop the infection from ever happening in the first place. And on the other side, you have early detection through screening tests, which can find those precancerous cells, that dysplasia we just talked about, long before they get a chance to become cancer. So what does screening actually look like? Well, we've got two main tests in our toolkit. The Pap test is kind of like a microscopic search party, looking directly at the cervical cells for any suspicious changes. The HPV DNA test, on the other hand, looks for the virus itself, specifically those high-risk types that are known to cause cancer. And when you use them together, they are an incredibly effective system for early detection. But okay, what happens if a screening test does find something? Let's walk through what the next steps look like in the treatment pathway. Now, a really important thing to remember is that an abnormal screening result does not automatically mean you have cancer. Not at all. It just means we need to take a closer look. So the next step is usually a diagnostic procedure, like a colposcopy, where doctors use a special magnifying tool, or a biopsy, where they take a tiny tissue sample to get a definitive answer. What these procedures do is give doctors a crystal clear view of what's happening at a cellular level. It lets them confirm if the changes are still precancerous or if they've actually crossed the line into cancer. And having that precise information is absolutely essential for planning the right course of action. This slide right here. This shows you why timing is everything. Just look at the two pathways. If we catch it early at that pre-invasive stage, the treatments are often pretty minor procedures. But once it becomes invasive cancer, the treatments get so much more aggressive. We're talking major surgery, chemotherapy, radiation. The difference is just stark. Early detection isn't just important, it is completely life-changing. So when you look at all the science, all the data, the message becomes incredibly simple and clear. Vaccinate. Get screened. Prevent. It's a three-step formula that could literally save millions of lives. And that leaves us with a final, really powerful thought. I mean, think about it. We have a vaccine that prevents the main cause. We have tests that can find it before it even becomes cancer. With these tools, it's really not a question of if we can beat cervical cancer, but when. Could this become the first cancer that humanity actually eliminates from the planet? The power truly is in our hands.